Hans Bergström, you have a doctorate in political science and you are the former editor of the leading newspaper in Sweden. Thanks for joining us. How are you?
We are fine. We're isolated where we are, so we are healthy. We are above, both my wife and I are above 70, so we have to be cautious.
So you're shielding. I would like to talk to you about the situation in Sweden and its fairly novel response to the coronavirus. Things that stand out to me: Sweden has one of the lowest population densities in Europe and a low level of multi-generational mixing when you think of countries like Italy, Spain, cultures where often grandparents will live with their children and their grandchildren. And the same is true of Sweden's geographical neighbours. So why then are we seeing such a high death rate in Sweden by comparison to its Nordic neighbours?
Yeah, I just looked this morning, and Sweden has now about 7 times as high death rate as Norway and Finland, and about 3 times as high as Denmark, with about the same social structure. There is one difference, though, and that is that Sweden has many more immigrants from Africa and the Middle East, so it's 2.66 million foreign-born, or with parents both foreign-born in Sweden, out of a population of a bit over 10 million. So it's 25% of the population. And in those neighborhoods where they are concentrated, there you have a density in living in the apartments, but also density between generations. And also many from that community is also working within the nursing, old age nursing, so that could be a factor. But the difference towards Norway, Denmark and Finland is so large, so it must be explained mainly by the difference in strategy in meeting the coronavirus.
So could you just outline then sort of what the approach is in Sweden compared to its neighbours?
Yeah. Well, all the others, Denmark, Finland and Norway, they had an early lockdown and a near total lockdown of society in order to achieve this physical distancing and crush the development of cases that way. Sweden took a completely different approach, and I'm not so sure it was deliberate. I mean, the prime minister was caught by surprise, didn't act at all at the beginning. And there is a tradition, administrative tradition in Sweden, also giving a rather high leeway to public agencies. So a state epidemiologist at the Agency for Public Health took the lead and was very convinced at every stage the virus would not come to us from China. He advised the many families going to the Italian ski resorts during sports break late February that they could go without any problem. And when they returned, he gave the recommendation that they could immediately go back to school and work, even if a family member was sick. And nothing was really closed down. Even the Swedish ski resorts were open for Stockholmers. So that contributed to a spread. The idea from this Agency for Public Health was that it was enough to find individual cases and then trace the contact pattern, which Sweden is good at, and then isolate them, and that would be enough. But soon it was discovered that it was a much wider spread, so you had to move towards a mitigation strategy. But even that has been much more loose than in our neighboring country. All schools are open at the compulsory school level 1 to 9. Restaurants and gyms are open. And most things go by recommendation only. And so I think that's the main reason why Sweden has such a high death rate.
There has been some tightening, hasn't there, of controls, and they have introduced some penalties as well, but still by no means a complete lockdown. And actually, by introducing those sort of tighter restrictions, that's coincided with Norway and other neighbours. They've sort of loosened their lockdowns, and Sweden is now sort of in the same area as those countries, isn't it?
Yeah, I mean the prime minister had played catch up, so he has. But not until 1st of April did the government take a decision for a prohibition for visiting old age homes. And they also reduced the recommended number of assemblies from 500 to 50, and with also a certain sanction if you move beyond that. So it was a certain change in policy around 1st of April, but that is quite quite late. My perception after knowing how the political system and administrative system functions in Sweden is that it was not such a deliberate policy from the government to have this. I mean, Sweden has a tradition of very, very hard measures when it comes to infectious diseases. It was one of the toughest nations in the world when it came to HIV, and before that the cholera, etc. So this time is the opposite. So it's not Swedish tradition to be loose against infectious diseases. So I think it's as often in life, it's not as intentional as it looks.
I wonder if we could explore a little bit the assumptions that Sweden's approach was based on. I think you've touched already on one, which was that the virus probably wouldn't spread out of China. But I'm right as well in thinking, was there also not a belief that a lockdown is not sustainable in the long term? For instance, looking at the UK's 5 tests for leaving lockdown, they can basically only be satisfied with a vaccine, and that could well be, a year or 18 months away.
Yeah, that's very true. That was a main argument given. And I think it has been of some value for society that schools have been kept open, for example. That has made it possible for healthcare personnel and others to go to work. And the healthcare system has been able to take it, even if it's under strain. But it was also an assumption from the experts at this Agency for Public Health that you would not be contagious until you had symptoms. And that's why they not only said that you could go back to work, they said that you should go back to work, even if you had sick members of family. And now we know that you are most contagious immediately before the symptoms show up. They didn't know about that there were these people without symptoms at all still having the virus. But that goes to a deeper point, and that is, how do you handle a situation where you don't know? I mean, it's a completely new virus. We don't know its characteristics, and still at every stage the authorities acted with such conviction that they absolutely knew what was the right course. And of course, you have basically 2 options when something new like that comes. Either you act strongly immediately and shut things down when needed, and just to be on the cautious side, and then see what happens. And if you have overreacted, then you can take back some of the actions. And that's basically what Finland in particular, isolating the whole Helsingfors region, and later Denmark and Norway did. Or you can guess and hope for the best, keep the economy open as much as possible, and then sharpen the tools as time goes. And that's what Sweden did.
Could you explain in a little more detail the separation of political institutions in Sweden? Because in the United Kingdom, basically all of the decision making has come from the executive. It's come from Downing Street, and scientists are advising, and they feed their advice, and they're reporting into Downing Street. But the decision is made by the executive, and that's not quite the same as Sweden, is it?
No, it's not, and it's a very unique model. Only Sweden and Finland has it. The separation between small government ministries and large agencies. And as you might know, Finland was part of Sweden for 600 years, so that's why Finland also has that model. While in the UK, a minister is responsible for every mailbox in Scotland. So that's, but one must also understand that it gives a government and a prime minister the possibility of blame avoiding to some degree, that they can let an agency do its work and take responsibility for its work to a certain degree, if it so wants. But if it would like to bring up the decision at the government level, it can do that too. So in the final end, if it would show when all this is time has passed, that the death toll in Sweden is totally unacceptable, then the prime minister cannot avoid responsibility for it. And as we talked about, it has been a certain catch-up in decision-making where the government has intervened to some degree when it comes to nursing homes and also gatherings. But one should also be aware that the reality is not quite the same as public decision-making. Swedish industry had a much stronger action early on. Companies like Ericsson and Scania, Volvo and others, H&M, etc., IKEA, they asked all personnel that could to work from home early on, and that's quite easy in Sweden since it's such IT competence. And they also took responsibility for their personnel to shut down activities. And there's been no order to Swedish industry to shut down from the government, but still it has been necessary for several reasons. One is that there is no demand. If you get big trucks from Scania and Volvo, nobody wants to buy them right now. So they had to shut down the production for that reason. And then you have the supply chains. And that's, of course, a major discovery during this crisis, how extremely interdependent we are. So they have not been able to get input goods for production. But the third issue is that the global companies have had to impose the same types of regulation all over the world. And then it has been harsher measures than what the government of Sweden has recommended. When it comes to the domestic economy, restaurants, gyms, etc. are still open in Stockholm. But of course, you need to have the trust of the customers too. So there are fewer people, but still many more than I found it astonishing, being a Swede, how some people act. And you say that it's such a trust from the Swedish population towards authorities, and they take responsibility for their own actions, etc. And you can to some degree rely on that. And that's true. 90-95% of Stockholmers did not travel outside Stockholm during Easter, for example, which is normal. But with a contagious virus, it's enough that you have a few free riders. So you can have 100 people acting irresponsibly, and they can have a major impact on the spreading of the virus.
Yeah, that can have a really big impact, yeah. Interesting point about the executive being able to perhaps apportion some blame and responsibility to Sweden's Public Health Agency, because even though the two are together in the UK, they still often, there's a lot of the press conferences, there's still often, the science says this, the science backs that, and I think there is still, they're trying to create that degree of separation. But this is interesting because some in number 10 Downing Street, it's reported, believe that Sweden's case essentially offers a way out of lockdown for the United Kingdom, that we could replicate that approach. Yes. Do you think that's a good idea? What would the consequences of that be?
Yeah, that's interesting because in the discussion, in the public debate, it has been described as a kind of goal conflict between the economy and deaths and health measures. And maybe it is, but maybe it's not. I mean, if this tougher type of action that we are seeing, for example, in Denmark, Finland, Norway, early on, leads to that you can also open up earlier, that you push down the number of cases to such a low level that it will be possible again to just take the cases to test, find a few cases, trace the contacts that person has had, and then isolate. If you get back to the numbers making that possible, then the other countries will be able to open up earlier than a country where you have a long time of high number of cases. And in Sweden now, it's stabilized a bit, but the number of new cases every day has not really gone down. It continues to be high. And if it's high for 2, 3, 4, 5 months, then it will be very hard to open up because, I mean, endurance and open of the virus and opening up is a bit contradictory. And it's not just, as we know, a question of public policy, it's also a question of the trust from the population and who dare go to a dense restaurant in these times.
Yes, indeed. How do regular Swedes feel about this? Are they angry? Do they think it's going well? Are they supportive of the government?
To my surprise, they are tremendously supportive of the government. And it's been a custom that after lunch every day you have this television show where this state epidemiologist presents the latest statistics. And I don't know, he has become some kind of Anders Tegnell. He has a long background. He's been out fighting SARS in Africa and so forth, so he knows his stuff. But you can also be caught in groupthink in a small environment. He has his show every day, but he's so he's not media trained, but if I put it that way, very boring, just statistics and dressed badly and etc. But somehow that installs trust in the population. He's not a politician. He doesn't act like a politician. He's not endearing himself to us. He just gives us the numbers. I'm very surprised of the reaction. Of course, it gives a certain feeling that you have been entrusted with your own actions and taking responsibility. It gives more of liberty to go out, etc. But it also becomes some kind of national pride. Oh, we have a different model than everybody else, and we are proud of it. And it's a more liberal model. It's a more open society model. So up till now, it's I would say 2/3 or so of the Swedish population is seems to be very much in favor of the policy. And astonishingly, also the opposition. I mean, we have 5 opposition parties, and they all support the policy. And I mean, that's partly it is a consensus. Partly it is that they feel where the public opinion is, and this trust in the policy somehow from the population. And partly it is the old consensus culture. That in crisis you assemble, you have weekly meetings between all the parties, and you are informed about everything, and then you go out and say, "Oh, we're in this together," etc. But I think later on that's temporary. It depends on where the death numbers go and what's happening at the nursing homes, etc.
Well, yes. On the point of the deaths, I mean, do you think this has essentially been a gamble with public health, and that now many Swedes are dead that would otherwise be alive?
Yeah, I calculated this morning, and if Sweden has had the same death rate as Denmark, there would have been around 1,500 fewer deaths by now. And we were on exactly parallel track to Denmark just 3 weeks ago. It's a doubling of the number of deaths just the last 2 weeks. So it's quite obvious that it is about the strategy chosen, but of course in Sweden, like in all other nations, it's also starting a discussion about when to open up the economy and how to open up the economy, etc. And the main opposition party, the moderates, the sister party of Boris Johnson's Tories, they have pushed. They are focused more on opening up the economy and how do you support industry so that it survives, and small business, etc. So they survive in order to be able to stay alive. But still, I don't really understand, because if nothing is in the industry is closed down by government order, how can you open up by government order? It's you have to fight the virus first, and before you can really open up, and that goes to the issue of testing. And it's been quite slow there too. And now it has been developed a new test at the Karolinska Institute and the Royal Technology Institute in Stockholm with nearly no false positives. Antibody test, which is really what is needed. So I think there's a plan now within 3 or 4 weeks to have a statistical sample of people, particularly in Stockholm, to see where we stand when it comes to immunity. And it's been obvious, by the way, that should be mentioned, it's been obvious from very early on when the spread started that the Agency for Public Health have been governed by the idea of reaching herd immunity, and in Stockholm in particular. And there are some numbers from the first antibody tests at hospitals saying that about 25% of hospital workers have had the virus and become immune, having antibodies. But that's probably above what the general population have. And as we know, if a virus is so contagious as COVID-19, then you have to reach a level of 60 to 70% of immunity and people having antibodies in order for the herd immunity to kick in and stop the virus spread of the virus. And that's far away. And then, of course, it's a question of the death rate. If you go for herd immunity, letting the virus spread, but in a way that is not overburdening the hospitals, then what is the death rate resulting from that? And we don't know. I saw the mathematician in Stockholm now that the public health agency is leaning towards. He now believed that it was 0.4%. Others say 1%. Others say that it's like a normal influenza with around 0.1%. But I mean, if it's 1%, then it's a heavy death toll coming from the herd immunity strategy.
Yes, absolutely. But do you think it's fair to describe Sweden's current approach as herd immunity, or is that
Yes.
not you do think that's fair?
Yes, that's the basic thinking behind it. It should be noted also that it's very much disputed among epidemiologists in Sweden, and 22 of them wrote an article. The leading professors in this field wrote an article in my old paper just about a week ago, strongly criticizing the chosen strategy and demanding the resignation of Anders Tegnell, the state epidemiologist, and demanding the government to take over with a different strategy. And one reason why that is still discussed is that the spread in Stockholm has gone very far, but that you have the rest of the country. So as you mentioned, it's a wide country. It's a big country in terms of landmass. There's still a chance of stopping the spread, perhaps in other parts of the country.
Just finally, Hans, a word on the Princess Sophia. I saw that she has, I believe, given up her royal duties and is training as a nurse in order to contribute to the COVID-19 effort. Is that sort of a fairly typical bit of behaviour from a member of the royal family, or is this quite an extraordinary thing to be doing? And how do Swedes feel about that?
They feel good about the royal family, and Crown Princess Victoria is tremendously popular because she's quite a normal person and with a lot of empathy, and so I wouldn't be surprised if they would do something like this. It's a tricky balance for the king in particular. He can express his support for a policy that everybody embraces, but if there's any controversy around the policy, then he has to be cautious. He is supposed to stay out of politics completely, but of course he can. This is a type of crisis where he can express empathy and try to contribute to unity and the whole in the nation, etc.
Yes, the Queen here did something similar a couple of weeks ago. Hans Bergström, thank you very much for taking the time to speak to us. I really appreciate it. Thank you.
Yeah, stay healthy in London too.